Hi guys, I'm Katie and I'm a podiatrist from the Podiatry Point here in Toowoomba. I've got Alicia with me and she's been coming to see me now for a few months with some ingrown toenail problems. As you may have seen from our latest series, we've talked about some conservative methods, some common mistakes and how to cut your nails properly, but she was still having some issues. We've decided for her the best option is to have nail surgery. This is her long-term best option. What I've already done is given her a local anaesthetic in the toe. So this is 2 injections either side of the toe and it will make the toe numb, ready for surgery. It is considered the worst part of the surgery because you are putting such a large amount of fluid into such a small area. But it's generally not considered too painful and hopefully not as painful as the ingrown toenail itself. Now what I'm doing here is performing a partial nail removal. But we do also perform total nail removals where we take away the whole nail. It just depends on the severity of the ingrown toenail. What I've done is applied some betadine to the toe to sterilize it ready for surgery. I've also applied a tourniquet, which is the blue device around the toe, and this is to prevent any bleeding during the surgery. What I've then done is use the elevator to loosen the skin surrounding the nail and make it easier to remove the nail later on. Once I've done that, I then use the elevator to actually go underneath the nail to remove it from the nail bed. Then the thwaites are used to cut a nice, neat, straight edge and give the nail the best cosmetic appearance possible. The beaver blade is then used to cut the piece of nail that you cannot see under the skin. Once I've done that, I then use the forceps to clamp onto the toe and the nail and to twist towards the midline. What this does is it then removes the nail nice and easily and no issues. Once I've done that, I actually check the nail and the nail bed to make sure that there's no piece of nail left in there and that there's no fibrous tissue or scar tissue that could cause some issues with the phenol and cause it to not work. Once I've done that, I apply some Vaseline or glycerol to the area just to protect it and make sure that there's no complications with the phenol. The phenol is actually the really important part, and this is the part that actually stops the nail from growing back. So for this, what I do is I apply the phenol to the area for 1 minute, and I actually do that 3 times, and it's applied with a Q-tip. So what we're trying to do is make sure that we disrupt the nail bed as much as possible so that it doesn't grow back. If you are having any issues with any ingrown toenails or you think that it's something that you consider for yourself or a family member, then please feel free to get in touch with us here at the clinic in Toowoomba. We are more than happy to answer any questions you have. Now for follow-up appointments, we have made them for 1 week after the surgery, and normally we see you about every 2 weeks afterwards for maybe 2 or 3 times, depending on how well we're healing. Hopefully we expect you to be fully healed within about 6 to 8 weeks. Now, once the tourniquet is removed, I check that there's good colour return and no problems with that. And then I'll apply a dressing on the toe to keep it clean and sterile and allow for the better healing. So once the dressing's on, it stays on for 24 hours. Now, Alicia came back in after 1 week, and this is what the toe looked after 1 week. So nice, clean, no issues. Thanks for watching, guys. Bye.